Good morning and welcome everyone. Hi everybody, welcome. I'm Andrew Schiff. I'm the CEO here at the Rhode Island Community Food Bank. Thank you for joining us for today's town hall meeting and the release of our 2024 status report on hunger in Rhode Island. This is a hybrid meeting. So we are actually here, believe it or not, in the warehouse of the food bank, and we have a small audience here with us this morning. We also have a larger audience on Zoom, and we want this to be interactive. So there's going to be a chance for either audience to ask questions. If you are joining us online via Zoom, you can pose your questions in the Q&A box at the bottom of your screen, and we will make sure to get to all the questions that folks have here and online after you hear from our guest speakers, who I'd like to introduce now. We have Wiona Nelson Davies, Executive Director of the Economic Progress Institute, Heather Holst-Strout, Executive Director of the Dr. Martin Luther King Jr. Community Center in Newport, Imani, a community member who's also joining us, who's from Newport. And I want to introduce Lisa Roth-Blackman. She's the food bank's Chief Philanthropy Officer, and she's going to help moderate and facilitate the Q&A. Let me begin by summarizing the major findings in this year's status report. We are focused on the hardships facing low-income Rhode Islanders. They are struggling because of the high cost of living, the high cost of basic living expenses. They're struggling to pay the rent, the utility bill, and afford adequate food. Results from the Rhode Island Life Index, which is conducted by Blue Cross and Blue Shield of Rhode Island and the Brown School of Public Health, show very high levels of food insecurity in Rhode Island. 38% of households report that they're running out of food. Even higher rates are reported by Black households, that's 47%, and Latino households at 55%, more than half. Many low-income families are enrolled in the federal nutrition programs, SNAP and WIC. There are 145,000 Rhode Islanders enrolled in SNAP, about 18,000 women, children, infants enrolled in WIC. School-aged children of low-income families are also eligible for free breakfast and lunch at school. And many households also rely on food pantries and meal sites that are member agencies of the food bank. We have 147 member agencies across the state. And each month, over 84,000 people are served at food pantries in Rhode Island, up from 78,000 last year. When we add up all the meals provided by the federal nutrition programs, by the food bank, household income used to purchase food, we find that low-income families still miss meals. Rather than having 3 healthy meals a day, they miss 16% of the meals they need. This is the essence of food insecurity: running out of benefits, running out of money, running out of food, and missing meals. Along with showing the extent of missing meals, this chart also does a good job of showing the importance of SNAP benefits. SNAP benefits provide close to 1/3 of meals for low-income families in Rhode Island. If we want to close the meal gap, the best way is by increasing SNAP benefits and making sure that SNAP benefits reflect the real cost of food. There's an opportunity right now for Congress to increase SNAP benefits. because Congress is considering the Farm Bill. It only comes up for consideration every 5 or 6 years. Now is the moment when Congress could reauthorize SNAP with higher benefit levels. My worry is that Congress will actually cut SNAP benefits in the Farm Bill, which will only send more people to food pantries and only increase the meal gap. Earlier, I talked about the high cost of living in Rhode Island, and that was based on the Economic Progress Institute's report, the Rhode Island Standard of Need. So we're very happy to have Wynonna Nelson-Davies with us today, Executive Director of the Economic Progress Institute. Welcome.
Thank you, Andrew. Thank you, Andrew. Thank you for having me. And it's important that we talk about what the reality is in Rhode Island for our families and individuals. So I'm glad to be a part of this conversation today. Let me have just turn it off. Okay. So I'll be presenting some of the findings from our 2024 Rhode Island Standard of Need. And what this report is really diving into what is the cost of living in Rhode Island and how are families able to meet that cost of living. So we dive into what are the economic needs of Rhode Islanders. Why this report? There are a few reasons why we've produced this report at the Economic Progress Institute since 2001. And it's because a lot of the programs like SNAP and cash assistance, we use what we all know as the federal poverty level as measurement for what poverty is, as measurement for what people need to be in order to get help. And that is an outdated measure of need. It hasn't been updated since the 1960s. So it doesn't tell us the real story of what people need to be able to meet the basic needs. And so the Rhode Island Standard of Need is a report that dives into what do people actually need. As you see here, for a single parent family, right? So we did a scenario, one single parent with 2 children, preschool and school-age child. Their expenses are close to $83,000 a year. The federal poverty level we use for SNAP and other benefits are closer to 100% of the federal poverty level. This is almost double what people are experiencing, and this is what we use. So the standard we're using is not sufficient to tell us where are the gaps in income and expenses. Sorry, it's hard to navigate looking back to see if it's moving. So here are some numbers, and these are not good news. So I'm not here, unfortunately, sorry, it's Monday morning, and I have some bad news. But hopefully that will help to ignite some action going forward. So a couple of the scenarios we use, just so you have an idea of what families are dealing with. The single parent I talked about will need close to $99,000 in order to meet their basic needs. 2-parent household with 2 children needs $107,000 in order to meet their expenses. A single adult, defined as someone without children, needs about $48,000 a year to meet their basic needs. In this report for our 25th anniversary, we did 10 different family scenarios. So beyond these, you can do 2 single adults living together, 2 parents with 4 children living together to find out what they need in Rhode Island, what they need to earn to meet their basic needs. This year, we also added a family budget calculator that will be put in our website early 2025 that you can go in and play with different scenarios for your communities to find out what those needs are as well. And so these are in our report, we have about 10 different family scenarios. And if you go on our website, which I will share later, you can estimate what people would need. So for example, 2 parents with 4 children would need $138,000 a year to meet their basic needs in Rhode Island. And what are those needs? And we're talking basic. We're not talking Dunkin' Donut coffee. We're not talking movies. We're not talking vacation. We're talking about what people need to live. So housing costs, childcare, food, transportation, health care, utilities, those are the basic needs. And that single parent, these needs add up to about $83,000 a year. And so that is really expensive. So as we look at this, we think about how many single parents are making that $99,000 a year and how many can afford these $83,000. Not a lot. So for a single parent with 2 children, 78% cannot meet their basic needs in the state of Rhode Island. Single adults, 68% cannot. For a 2-parent household with 2 children, 34% cannot, which is a little bit of good news. However, when you break that down by gender and race, we see that there are disparities between who in Rhode Island can meet their basic needs. We also, for the first time this year, broke down the Rhode Island Center of Need by geographic. So we look at where in the state is more expensive than other places. Newport County came out as the highest level of cost of living in the state of Rhode Island. So that single parent would need $109,000 a year to meet their basic needs in Newport County. And we broke it down. Kent County is actually the average, and it pairs up with what people would need in the state of Rhode Island. And I'm going to have more time to talk through these slides because I know I have limited time to be up here. But I want to highlight a couple of other things to end. We have cash assistance and SNAP that help those who cannot afford it or can work and earn to be able to meet some of their needs. However, even with Rhode Island Works, cash assistance, and SNAP benefits, someone average income is about $1,700 a month. Their expenses closer to $4,400 a month. So there's a gap even between the SNAP benefits that are provided and the cash benefits that are provided. Same thing with SSI. Income is about $1,200 a month, expenses about $3,000 a month, and there is, again, remain a gap. So one of the things we do in this report is say, okay, we understand there's gaps. How can we close the gaps? Some of that is through child care assistance. Some of it is through programs like SNAP, and then through Medicaid assistance as well. That helps to close the gap for some Rhode Islanders, even though they still end in the red every month. We also decided, okay, beyond that, is there anything else we can do to continue to close the gap? So for this scenario, for a single mom with 2 children, if you have child care and health care, housing subsidies can also help, as well as child tax credit. And those are different programs that we can help to close some of these gaps. And we highlighted, I know most of us already know that most Rhode Islanders are house burden and cannot afford it and need about $3,300 and $33 an hour in order to afford housing. That means most people have to work 2 full-time jobs to be able to afford housing in Rhode Island. The elderly as well are also struggling to meet their basic needs in Rhode Island. And so I'll end here. And as we discussed, there are a couple of things. Some of these programs that help close the gap, as we know in 2025, with the Farm Bill, with Medicaid, there may be cuts coming our way. And that's the opposite of what we need right now, right? And so we need to think creatively about how we're making sure our families and Rhode Islanders have what they need. Right now, we're talking about basic needs. That is not where we want to be. We want to be where people are actually living and not just surviving. And eventually, we want Rhode Islanders to thrive. And so this report is really thinking together as a state, as a whole, how can we make sure we have the environment needed so people can be able to not just meet these basic needs, but also to thrive. And I'll be happy to have more of this conversation going forward. Thank you.
Thank you, Wayona. Now I want to involve our guests from Newport. We're going to transition. I'm going to move from here to sit down, so it's a little bit more like a conversation. But Imani, let me start with you. Can you tell us a little bit about how you first connected with MLK Community Center?
Sure. When I moved to Newport, it was because my husband PCS'd here. He's in the Navy. We had just had our 3rd child, and she was about 6 months old when we moved here. When when he PCS, she was a newborn. So we were 6 months separated. We were in Florida still, and he was here by himself. When we came here, it was kind of like a culture shock because where we lived in Florida, it was closer to like Alabama, like Pensacola. So the cost of living was very low. And when we came here, our income not only did not increase, it went down. One, because we have a house in Florida that we are still paying mortgage for, and two, more children, so more food. So when we came here, it was a very culture shock because we were used to being very self-sufficient. And we came here, we got our first daughter in school because she had just turned 6, and she had just turned 5. Then our second daughter, she got accepted to Head Start, which the Head Start personnel that they assigned to my child, she told us about the food bank in Newport, and that's how we got connected, and I've been going there for about 2 years now. Yeah.
Thank you. Heather, in terms of everything you've heard about the statewide numbers, what you're seeing at MLK reflect that?
Absolutely, and seeing those numbers, and I've known those numbers, but it really just emphasizes why the need is greater than ever. In fact, my director of hunger programs, Ed Crowley, sent me the October numbers about a week ago, and he said that our numbers in October were double what they were last year at the same time. Now, we did just do a renovation and expansion of our building, so when they say build it and they will come, so I do think a part of that is that it's just such a more welcoming, respectful space, so people do feel that they are in a place that really matters. So that is a piece of it, but much more than that are those numbers that you just saw up there. And many people think of Newport as a place of the rich and famous, and certainly there are some very wealthy and famous people living in Newport, but it's the 5th poorest community out of 37 in Rhode Island, and that's what a lot of people don't realize. And so those numbers very much reflect what we're seeing.
Imani, you know the Newport community, you live there. When you think about folks needing help in Newport, what do you wish they knew? What do you wish they were told?
Well, I don't feel like a lot of people have access to what I had access to. A lot of the times it's because I actually have access to the military. They do a good job of providing a place to stay where you are. So my daughter even being able to go to Head Start was a blessing in and of itself. So the resources that pour in from certain programs are very necessary, which is how I got connected to you guys. A lot of people don't really have that. Some of them, I see people like just hanging around Stop and Shop outside. Either they're waiting on the bus or they really just have nowhere to go. I don't know if they're homeless or what the case is, but there's a big gap. Like it almost feels like there's no middle class. Like I know that sounds crazy, but it's a very either black and white, barely any gray. Yeah.
Well, we've certainly seen, because of the high costs, we've certainly seen the problem of food insecurity expand from low income to more moderate income families. It is just so impossible to be able to keep up with the cost of living, and military families have set pay, and it just makes it very difficult. As you said, you move from a place that was affordable to Newport that's unaffordable.
By far. By far.
So I'm going to broaden the lens back out a little bit and start with you, Andrew, and ask the question, do we ever see the need for food assistance go down, and what factors were at play when that happened?
So we did see the need for food assistance go down, and that was when there were a series of programs during the pandemic that Congress passed. And it's some of the ones you mentioned. So we had a child tax credit, which certainly would help. We had free school meals for all children, breakfast and lunch for all kids in school. SNAP benefits were increased, WIC benefits were increased, and it was very clear. It was like a test of the system. Would those programs really mean that families were going to be more food secure and more able to afford food? And the answer was yes. When all those programs went away, after the pandemic and COVID relief ended, we saw a tremendous increase in the number of people coming for food assistance. And now that has been made worse, of course, by just increases in rent, utilities, and pretty much everything that families need to just meet their basic expenses.
And Heather, I wonder if you can speak. I feel like I remember talking with you during that time and hearing what the experience was on the ground when people had those benefits. I don't know if you can think back and just tell everybody a little bit about what that looked like, what you were seeing at the MLK Center for all the different services you provide.
Yeah, it's hard to look back and think about that time, but it was definitely a time where our government reacted and really built the supports underneath the people to lift them up and take care of our state, our country. And we did see, of course, when COVID first hit, we saw a very significant spike right away because it took a little bit of time for that reaction to happen. But once those supports were built in, we saw people still coming to our pantry, but our numbers really leveled off. And then, just like Andrew said, now we're seeing this. Like I said, from a year ago, our numbers are doubling. That is, we've never seen anything like that. And honestly, that's just not sustainable. Yeah. It's scary.
And tell everybody, aside from your food pantry, which is what we're talking about here, tell us just a little bit more about some of the other services that you're providing at the MLK Center.
Sure, I'd love to. So we really have made a conscious effort over especially the past 5 years to try to reach out into the greater community. So we have a mobile food pantry that goes out to 17 neighborhoods throughout Newport County, which is 7 different communities. We have 2 school food pantries, one at Middletown High School and one at Tiverton High School. We have a Food to Friends delivery program where we bring groceries out to about 1,300 homebound seniors annually. Those people can order what they want and we bring them what they need. We also have breakfast 5 days a week. About 75 to 80 people come for breakfast at the center, hot breakfast every morning. We have lunch 3 days a week. We have a tremendous Produce to the People program that goes out, and I know Amani really loves that. I'd love her to tell more about that in a minute. But so last year we distributed about 245,000 pounds of fresh produce to the community through Produce to the People and other programs where we are letting people come select fresh, delicious produce for their families on a weekly basis so that they can fill the gaps from when they're shopping in the pantry with fresh food.
Great. Imani, do you want to weigh in a little bit on that and what that's meant for you and your family?
Well, we do go to lunch sometimes, but the biggest thing for me and my family is the Produce to the People. Every single week I am there at 10 o'clock. And I say that just to say, it's very important because a lot of the times you notice that, and I'm not saying that, canned food is not good, but most of the things that are in pantry is long sustaining items like canned goods and, foods that have preservatives. For my family, when we lived in Pensacola, fruits and vegetables were way cheaper by far. Like double the price. I was telling them the other day that I compared a bag of green peppers. I think it was like $8 plus, $8 and a couple cents here, and in Pensacola it's like $3 and a couple cents. So you can see the difference there. So what we were accustomed to eating back home, we couldn't do that here because the money just was not stretching. So when I found out about the weekly fresh produce, I hopped right on it, and we now, for the past 2 years, we've been planning our meals around what's available, because obviously every week it's not the same thing because it's local farmers, right? So we just plan our meals around it and we make it work, because what's better than fresh fruits and vegetables?
Fantastic. And Heather, I wonder if you can fill in a little bit, just for everybody that's watching here and online, to explain how this system works. You're getting, I'm assuming, some of that produce from the food bank, but tell us a little bit about where are you getting your supplies to be able to help people every week.
So thank you to the Rhode Island Community Food Bank. We receive about 45% of our food through the food bank, and during COVID especially, I don't know what we would do without you, but certainly that continues. And then beyond that, we get about 25% of our food from donations, in-kind donations through either food drives at schools, businesses, individuals, and then the rest of that is through fundraised dollars. So we have a very generous community. We write a lot of grants, and it all just patchworks together. We get less than 4% of our funding comes from federal, state, or municipal resources, which is shocking to most people. So it really does happen through the generosity of our community.
Yeah, and that's true for the food bank too, providing to you and 146 other agencies. Andrew, I don't know if you just want to broaden out again to speak to all of that and a little bit of the scope and scale, and then I'm going to come back to a question for Wayono.
Yeah, well, I mean, we're distributing 16 million pounds of food this year to make sure that all of our member agencies have adequate food to serve everyone in need. I mean, what we're all saying in one way or another, for a family as well as a food bank, food is expensive. It's much more expensive than in the past. And it changes the dynamic. It changes how donations are given. Donations of food are weighed down because food is expensive. And it changes what it's like for families just to be able to have the basics. Costs so much more. And, you know, we keep coming back to families with children being one of the highest need, but it has to do with wanting kids to grow up healthy and be able to thrive. So we should have that as a goal as a state.
So Wayono, I want to bring it back to you for a minute. As you were processing all of this data, both the food bank's numbers and broad numbers about food insecurity, and the overall cost of what it costs to raise a family in Rhode Island. Now that all this is out here, what do you see as happening next? What do you hope policymakers will do? What's your vision for what happens in the coming months?
Yeah, so 2025 seemed to be a year that's going to be challenging for a few reasons. In this state, we are talking about a deficit. In October, we were told the state deficit would be about $400 million. After more information from agency, that deficit is closer to about $22 million. And so the state is thinking about cutting some state services. So Medicaid, right, is a agency that produces, a lot of what we need to be healthy. So Medicaid is in danger of being cut on the state level. But on the federal level as well, the Farm Bill, we don't know if that will be renewed to increase SNAP benefits. We don't know if Medicaid will be renewed. In the marketplace, a lot of people who are not eligible for Medicaid purchase health insurance through the marketplace, and they're able to do that because they get premium tax credits. That is set to be renewed in 2025. So what do I see on the policy level? It's going to be very challenging because leaders are talking about cuts instead of thinking about how to preserve programs that families really need. And we're talking about working families. We're talking about people who are working 2 to 3 jobs and yet cannot meet their basic needs. And so what I'm hoping state leaders will have the vision to realize that talking about cuts and making that the policy priority is not the way to go, especially where we are without cuts and people are still not able to afford it. So I'm hoping they can think about, one, how to raise revenue. That is something at EPI we talk about. In every budget, we know this, right? Income and spending. And so the state leaders and federal government need to think about how do we generate revenue so we do not cut. who needs to pay more taxes so we do not cut. And we're hoping they can put together some creative plans, working with nonprofits, because most of the time when our government is not able to do what they need to do, it is the nonprofit community that we reach out to. You know, it's the MLK centers and the food banks that have to come together and fill in that gap. So I'm hoping they get support and sit down with these nonprofits to think about what are the creative solutions beyond policy, but then also really think about starting with cuts is not where we need to start. We need to think about how to preserve and protect those programs.
You know, one of the things I learned from you was that, so the departments in state were asked to cut their budgets by like between 7 and 8%. But there's a lot of each budget that they can't cut. So the parts of their budgets that they can are actually they're proposing much bigger cuts than just 7, 8%. Can you say more about that?
Yeah, so every agency during the summer were asked to provide a budget, not expanding programs at all, even though that's what we needed, a budget that will maintain the services to provide, and then a constrained budget that will cut their budget by 7.5%. And that constrained budget, what it will do, from the state calculation, it will make the deficit come closer to about $19 million. So that is what they're hoping we can get. But however, like EO Issues S, for example, is saying we are producing Medicaid expanded for adults who are working and not eligible. So it's vulnerable populations that those budgets have been able to provide services for. This constrained budget will cut those vulnerable populations. So adults without children who are dependent on SNAP may be cut from our state budget if it goes through. Adults who are dependent on Medicaid and health insurance may have to be cut. And these are people, again, who are working, not making affordable, but now they're looking at a constrained budget that will cut those services to them.
So Imani, I'm going to bring it back to a personal level for a minute and just ask you to think about what would you say to other families or somebody else that's in a similar situation to you that's struggling? What would you want them to know or do or say?
That's a lot. But coming from both sides of the coin, right? On one end, it's very empowering to be self-sufficient, and then going to not being it can feel very shameful. Very hard to even come to a place. Honestly and truly, I told them the other day, coming to MLK, I was very hesitant. I didn't want to, I don't know if be a burden is the right word, but I didn't want to go into a place where I wasn't sure how I would be received. And I mean, I'm 2 years in, so we can assume that it went well, right? But they're really good over there with being welcoming, hospitable, very respectful, dignifying even, and being in a situation where you can't afford the basic necessity is food, right? It can feel very indignifying. You can't even provide for your family. And a lot of times people do look at families with children like, why have them if you can't provide for them kind of situation. And I was looking at a study the other day that said a high percentage, I can't remember if it was 65 or higher, of Americans are one paycheck away from being homeless, which is way worse, in my opinion, than being hungry. At least you have somewhere to be warm. So I would say, don't care about what people think, do what's best for you and your family, and look up programs. There are not many, but there are some out there, and take advantage of the resources that are available to you.
Yeah, thank you. And what would you say to people who are listening out there who have the capacity to help?
Ooh, do it. Honestly, yeah, just do it, like Nike. But seriously, just do it for real, because I'm a believer in Christ, and one thing I pray for every day is to one day be at the capacity to help, which is a big thing. Giving to the poor is really important. It not only helps them, but it's a guaranteed blessing from the Lord. Do it, because it is very important. The Bible says, the one who gives to the least of these gives to me. Okay, so do your best to actually go out there and do it.
Thank you. No problem. Do we have questions from anybody in our in-person audience here? And Kelly has a microphone if anybody does.
Be brave.
Be brave.
Hi, good morning. Thank you so much for this report, and thank you so much to the panelists for your really, really insightful and inspiring remarks. So my question is, what are things that we can do as Rhode Islanders at the local level, you know, in our towns and cities? What can we do every day or every week to make a difference?
First.
Way on it.
Well, I have some suggestions. So the budget I talk about, the governor is going to be proposing in January. I think it's important, one of the things you could do is to call the governor's office and say, do not cut SNAP, you know, do not cut Medicaid, do not cut these programs because we need it. And then, you know, when the General Assembly gets back in January, they're going to be looking at their budget. And I think for me, where I'm finding hope in the midst of all of this is, as Rhode Island, we're a small state. And I'm always thinking about how we can be a model for the nation, because a lot of states are going to feel the impact from the federal government. So how can Rhode Island come together, community members, policymakers sit down and say, let's be creative about how we can save our state. And so what you can do is volunteer and say, I want you to hear from me and my community about how we need you to step up. So I think that's one way you can help, by getting involved in the process, because the more people they're hearing about saying this is important to us, they're going to listen. And so from our perspective, I always encourage people to lend your voice, tell your story, so they know that these are real families and real people impacted, and we need to make better decisions for different communities.
I mean, I could list 1,000 ways that people can help, from donating a bag of food to the food pantry, to talking to other people about what food insecurity really looks like Amani, to a working family, two adults working. She was working overnight so that she could try to put food on the table of her family, and knowing that the reality of it is, in our state and in our country, that's not a reality for many people to be able to do. And I think, you know, I'm asked repeatedly, how do you know people aren't taking advantage? And I when people ask me that question, I get my guard up, because look at this. She's not taking advantage. And I will tell you, no matter what we do in life, there's always going to be those few that take advantage of something. But I do tell you that nobody wakes up in the morning and says, I want to go to a food pantry today and get food. People want to be able to provide for their own families, and let's make it easier for people who can't to just be able to get that help with dignity and respect. And that's what we try to do every day at the center. So that's what you could do to help.
Andrew, anything to add?
No, that was terrific. Thank you. I'm just wondering if there are any other questions.
Hi, my name is Andrew Bramson. I'm from Onward We Learn, Rhode Island's largest college access and success program for first-generation low-income students. Thank you for the panel. We're doing a lot around affordable housing at this time, lots of new units, lots of different types of strategies. Curious to hear what type of collaboration or sort of cross-pollination opportunities there are with affordable housing development and addressing these issues around food security.
You go again.
And she's letting me take the ball. So there's a lot of movement around housing happening in the state. In November, voters voted for a $120 million housing bond to build more housing, because we're facing a couple of issues, right? You know, homelessness have increased like 7% since the pandemic. We have a very short supply. We're hoping this bond will be able to build more affordable housing because, as we said, people are not single issues. It's not just food you have an issue with. You are making a choice between rent or mortgage and food and different transportations. So I think there's been a lot of conversation around different groups like API, Connect with Housing Works that does the advocacy around housing to think about how to promote building affordable housing in different municipalities. We only have 5 municipalities in the state that have met their threshold for affordable housing. Some are pushing back and don't want affordable housing in their neighborhoods. And so it's having that conversation to see all of us as one community and saying we need that, right? We need people to have somewhere to live, and we need people to afford it. So that's one thing that's happening. The other part that's happening is renter increases that are happening across the state. Providence have a very high rental market. And so thinking about how do we work with landlords? How do we work with tenants to make sure people can afford housing is something that I think we're having that conversation around. And again, connecting the dots with how much people are making and how can they afford housing without working 2 to 3 jobs. So I think those conversations are happening in different groups trying to understand if we address housing and food insecurity and address income, that can really set up Rhode Island to be able to succeed.
Hi, thank you all. This was really fabulous to listen to and to think about. I just want to add a comment about our immigrant population because I think they're at times left out of the conversation, and I'm really concerned, particularly right now, about what's going to happen with that population. And because many of those families either are ineligible to apply for or to participate in many of the federal programs, or maybe too intimidated or scared or not, and there's not a lot of opportunities to help. And I just think we need to keep that group in the conversation and continue to think about ways that we can make sure, even some of the SNAP benefit programs or the incentive programs, that's great for people who can get SNAP, but there's a lot of people who can't qualify, who don't qualify, or who are ineligible. So I just wanted to raise that as I don't know if anybody has a comment about that, but it's a huge opportunity or maybe burden for the pantries and soup kitchens, because that is one of the few places that immigrant families can go to and much appreciated. But I just wanted to raise that as an issue. Thanks.
It's really
I'd like
important.
to comment on that.
Yeah, okay. And just quickly, I'll say, Kathleen, that I absolutely agree, and I think that one of the things that happens when a community becomes so fearful that when they seek help, it's going to hurt them, hurt their family, hurt their status in the country, that actually it keeps them from getting any help. And we really try to make sure that our food pantries across the state, meal sites, are welcoming to everybody. And we try to make sure that people know that they are not going to be harmed by getting food assistance in those places.
Yeah, and I want to comment on that. So that the Hispanic population in Newport has really exploded over the past few years. In fact, it represents the largest demographic that we serve at the Martin Luther King Center. Beyond that, we do have child care programs, and we have we gave out almost $300,000 in scholarships last year to families who do not qualify for subsidies from the state for their children. In our preschool, there's about 60% of the kids in our preschool are from Spanish-speaking families, and so it's something that wraparound service provided is really, really important. And the food bank is really doing a good job at bringing in more culturally appropriate foods to all different cultures to make sure that we are making people feel that dignified, welcome, respected, that we all try to do together. But I think that making people feel safe. One thing several years ago, we ask only questions that we need to respond to grants. And we had a couple of our grants that wanted to know how many people were legal and illegal immigrants. And I was like, we stopped that several years ago. We will not ask that question. That does not matter. And we don't want that information. We just want to help people. And I think pushing back against things like that is a way that people, no one wants to be asked that question. And pushing back against those kind of conversations and just having people feel like they are just part of the community. Because I know in Newport, our hospitality industry is so reliant on that population. I mean, if you can't go anywhere to any business in Newport without knowing that that the Hispanic population is such a big presence and making our community what it is. So it's really important and for sure a group of people that we are taking very good care of. Yeah.
And I will add, and thank you for raising that very important question. You know, prior to EPL, my other hat I wore was as a legal aid attorney. And during the first Trump administration, the public charge, you know, where people were scared to get certain benefits because it was expanded beyond cash to SNAP and Medicaid. And so, you know, immigrants who got those benefits were now being told that could impact if you're applying for a green card. And a lot of people who were not even in the group of immigrants were scared to go and get health care, to get food at all. And so it is an issue that fear stopped a lot of people. And you raised a good point. We're advising healthcare centers, do you need Social Security? Like, what do you actually need? Because now we couldn't advise that their information would be protected. And so we started advising them about collect only what you need so people can feel welcome there. I think that's the first thing, to really start getting out the word about who's eligible, if it's not required by law, what to do to protect our community members. And then the second part too, there are some, like SNAP, you know, you have to be a permanent resident and certain immigrants to get SNAP. For cash assistance, for example, there's a 5-year wait bar on the federal level. However, as a state, if we invest general funding, we can now provide more for immigrants to have access to Rhode Island Works, for example. So part of the conversation is like, what can we do on the state level to give access to immigrants?
Yeah. I have a little thing to chime in as well, because I'm an immigrant. I came here legally back in 2012 with my mom. However, my mom was filed for when she was 18 before I was born. So it took a whole 16 years for her to get accepted and brought to this country. So my family has a mixture of legal and illegal immigrants in this country, and we're mainly based in New York. Speaking from experience, it's fairly easy for us to get SNAP and EBT. I don't know how it is now, given the current change that's going on. It's fairly easy, but there is a fear attached to it, like, are we gonna get deported if we're illegal? Or is this gonna affect me getting naturalized? I got naturalized back in 2019, and before that, I was homeless and all of the above in the state of New York. And I did get government assistance, and it didn't really hurt my chances, but that's just me. I can only imagine what it is for other people, because I'm just an anecdotal situation. But I do have family here that are illegal, and as far as them being scared to access help, I don't think they are, but that's in New York. I don't know about Newport as much, but given the recent change, you guys know what I'm talking about, there is a fear, even more so now, of getting government assistance out of fear of being returned from what you were running from. Because I guarantee you, people are not just coming here just because. A lot of the times it's poverty-stricken situations, which was my case and my family's case. Some people are running from death. Like, we have no idea. So, yeah, that's all I have to say about that situation.
So we had a question from Zoom, from one of our Zoom audience, and maybe, Wayano, I'll start with you, and then anybody else can jump in, is how important is it for people to share their stories and experience to highlight the importance of these benefit programs and defend against cuts in the programs, either for immigrants or for anybody. Tell us a little bit about how that has impact when you're up at the State House.
Yeah, it's very critical. We come with the data and the policy, but we cannot share, Imani's story. Imani is the only one that brings power to it. And our policymakers, if you show up for a hearing, so with all of these bills, there will be hearings, for people who may not know how the State House works. And so sending written testimony, showing up and saying, this is important, you cannot cut it because this impacts me. That helped us to back it up and say, yes, this is the 78%, and you're at 10 of those people within that 78% that are living in your communities that will be impacted. When they hear directly from the people who voted for them, it makes a difference. And so it's very, very critical, because I always share, we show up at the State House, we don't have money backing us. The only thing we have is people power. And so it's like representing what Rhode Islanders need is really important for us to show up and say, these are the people, we're not just talking for ourselves, we're talking on behalf of real Rhode Islanders who are in your communities, who are your neighbors. And when lawmakers hear that from more people, they have no choice but to pay attention.
Last question from Zoom. And I'm going to come back to Heather and Imani on this one. And this is actually from somebody who runs another food pantry in the state and wants to just have you speak a little bit to what specifically are some of the things that you can do as a food pantry, as any food pantry in the network, to create a welcoming environment and make sure that we're treating people with dignity. Tell us what that looks like at MLK and how you experienced it. Imani, I'll let you start. Heather.
I think Imani should start, because I would love to know what are the things when she comes to the MLK Center that make her feel welcomed and respected, and then I can elaborate on that, because I think coming from the voice of somebody who we provide services to, I think is really important.
Mm-hmm. Well, I told Heather the other day that they're doing God's work, and I am not backing down on that, because as I stated before, it can feel very indignifying going to a food pantry. Like, no one wakes up in the morning like, hey, let's go to the food pantry today. No one wants to do that. So when I come to MLK, the first thing I see is someone at the door smiling at me, like, quite literally. It felt fake at first, but as I got to know them, it's really genuine. They're full of love, full of light. And when you go in, they offer you a seat, you need water. Like, they're just very hospitable. Like, if there wasn't such a stigma attached to food pantries, I could easily see someone taking advantage of the situation and be like, oh, they treat me like a queen here, let me just go for fun. Like, it's so, like, welcoming, because I don't know how to put it. As I said, God's work. That's literally the only way I could sum it up. They're really great people over there.
Thank you. So I think one thing that we take very seriously, we have over 600 volunteers, and our staff have a lot of training on how to make sure that we're treating people with dignity and respect by not asking them. When someone comes to the door, we say, how can I help you? We don't make assumptions that somebody's here for help or to volunteer or to donate. We just say, how can I help you? And let them answer that question so that people aren't made to feel like, we've heard stories of people that would say, are you here for the food pantry, to somebody because of the color of their skin. We don't want to make those kinds of assumptions. Mm-hmm. And so also having people select what they want, not giving them just a bag of food, but we have a client choice, and everything that we do at the MLK Center is client choice. So if you don't want tuna fish, you don't take tuna fish. You choose from what you want, just like I do when I go to the grocery store. And that's really, really important to make people feel that they're not being forced to eat something that they shouldn't have to eat. And I think for COVID, for a short period, when we did have to do bag distribution, it was survival mode, and that's what we had to do because it was the only safe way to distribute food in the beginning. And I was so happy when we could stop doing that. But I also think making sure that not just your staff, but your volunteers, anybody who is working with people, all have that same training. And we also want to make sure that our volunteers reflect the people that we serve, which is a challenge. We try to have Spanish-speaking volunteers and staff at all times so that when somebody comes in for help, especially if it's their first time, that they are made to feel very comfortable and understood and So I would say those are probably the biggest things that I could say that would make people feel welcomed and comfortable.
And last question for you, Andrew. I wonder if you can broaden that out to the rest of the network and just say a little bit about what the agreement is between the food bank and the agencies that are members about serving people who show up and making all people feel welcome, and just say a little bit about how we work together as a network to do those things.
Sure. I mean, it's very important to us that anyone who needs food assistance can receive that help at any of our member agencies. And, you know, on top of everything else that you're doing, Heather, I also know that you listen. And I think that's critical for the folks at our member agencies. You had a focus group, and we had people receiving services at MLK tell you, you know, what their experiences is, what they'd like to see improved. We want everybody to have that perspective that we can't stop listening. We need to really understand who the community is, what they need, and the way that we can provide help that's going to be respectful to everybody. Was that really our last question? Well,
I'll let you wrap us up.
I just want to, first of all, thank three of you. Imani, I want to say how grateful we are for your husband's service. But your being here and, you know, the conversations that we have remind me that not just his service, the sacrifice of your whole family is something that we should all be very, very grateful for. So thank you, and thank you for being here. Heather, thank you so much. Leona, thank you so much for being here. If folks want to see the report, it's on our website, rifoodbank.org. If you have questions after today, please get in touch with me. We're glad to answer questions about the report. Anything else I'm forgetting?
Happy Thanksgiving.
Happy Thanksgiving. Thank you, everyone.